Hello dear students, welcome to the another video tutorial of histology, and in that we have started with the chapter 3rd, histological study of the organs. Okay, so we have completed with the skin, and today we are going to start with the histological organ, that the histology of the tooth. Okay, the basic structure of tooth. Okay, the models. Okay, and its representation, and its having the unique uh, pattern of the fixation into the buccal cavity. Okay, so we are going to study about the tooth. Okay, so in mammals or in humans, okay, so there are normally two sets of the natural teeth, the primary dentation, or the it's also known as the deciduous teeth, or it also known as the milk teeth. Okay, and second will be the secondary dentation of the permanent teeth. Okay, so hence mammals called as the diphodont. That means they are having the two sets of teeth to of their lifespan. Okay, so hence they are known as the diphodont. Okay, and that diphodont teeth means the first the milk teeth are going to shed off, and then the permanent teeth are going to take a place of that particular shaded teeth. Okay, so these or each tooth develops from the tooth germ divide from the ectoderm. Okay, and mesoderm. Okay, so ectoderm and mesoderm, they are having the tooth germ dividation, that tooth germ layers. Okay, so all teeth have same basic plan. Okay, so in human the teeth quite special because they grow twice during the adult lifespan. Okay, and they are essential structures for the mechanical digestion of the food. Okay, that cutting and churning of the food. Okay, and supports the certain facial features. Okay, like smile. Okay, so adult dentation consists of a 32 teeth. Okay, that share some common anatomical features and are classified into four groups, that are incisors, second will be the canines, third will be the premolars, and the last group will be the molars. Okay, so let's see one by one. Okay, the type of the teeth. Okay, so the addition to the specific naming and numbering dental anatomy is also unique. Okay, so in the possible types, the teeth and their respective numbers. Okay, children have 20 teeth. Okay, called as the deciduous or the milk teeth, as I mentioned earlier. Okay, so between 6 months and 6 years of the age, the first teeth will grow on the 6th month of that child, and their deciduous milks are last for the 6 years, and after that the first milk teeth going to shed off into the age of the 6th year. That means first permanent teeth is going to arrive or the originate into the 6th year of the life stage of that particular individual. Okay, into the humans. So this set is subsequently replaced by the permanent dentation of 32 teeth in um, adolescence and the adulthood. Okay, so the teeth names, how the teeth names are given. Okay, there are 32 teeth in total, the oral cavity or the buccal cavity of an adult with a healthy dentation. Okay, so one half or the 16 are embedded in the maxilla. Okay, that will be the upper part. of your mouth. Okay, the non-moving part is known as the maxilla. Okay, and while the lower half are situated within the mandible, that is your um, jaw lines, okay, which are going to move, okay, that are named as the mandibles. Okay, so the name of the teeth on each arcade is self-explanatory. Okay, and the top 16 are named as maxillary teeth, while the bottom half are named as the mandibular teeth. Okay, so the teeth and each row or that arcade are divided into four groups that are named as follows from the dental midline outwards. Okay, so there is a presence of the four incisors in total. Okay, that central incisors and the lateral incisors. Okay, then two canines. Okay, and then four premolars. Okay, on each side. Okay, and the 6 molar in total. Okay, that will be first molar, then second molar, and finally that will be the third molar, which is wisdom tooth molar, which is going to um, rise into the from the age 16 to the 21 years. Okay, that 21 up to the 21st year, this wisdom tooth is going to get arise from your um, jaws. Okay, so these some part is said that this wisdom tooth or this last, that is the final molar or that third molar, is a vestigial into the our mouth, but nothing like that. I personally feel that nothing is vestigial in our body till the date that our evolution going to shade off that thing. Okay, so as you can see in the picture, the overview of the teeth is shown. Okay, as you can see, the two incisor teeth have seen at the in the first, in the row that will be on the first and second number on your left. Okay, so the central incisor teeth, as you can see, the broad portion. Okay, and the lateral incisor teeth that are having the some the longitudinal portion of that teeth. Okay, that two type of the incisor teeth are shown. Then second main type will be the canine tooth. Okay, that canine tooth which is having the for the cutting purpose. Okay, so the third type will be the premolar teeth. Okay, that will be the first premolar teeth and second premolar teeth. Okay, that having the differences into the roots. Okay, so the next level will be the, that will be the molar teeth. Okay, that are having three type of the molars, that will be the second molar teeth. Okay, uh, then the first molar teeth, then the third molar teeth, that will be the wisdom tooth. Okay, so as you can see, the variations into the teeth. Okay, with their roots or with their structures of the crown. Okay, so as you can see, the we will see for the teeth anatomy. Okay, what is going to inside it. Okay, so the tooth structure first. Okay, the four group of the teeth are not identical. We have seen they are not identical, they are very much different from each other. Okay, their shapes and size are varies. Okay, they are not identical. Okay, but they are share a typical and general tooth anatomy as follows, but their anatomy is same, as the incisor teeth is having anatomy like the canine tooth, that canine tooth having the anatomy like the premolars, enamel, there will be the dental crown, that particular is shaded by the this enamel. Okay, enamel is a substance of advanced calcium like substance that are going to protect from the sensitivity to your tooth. Okay, and that is the hard covering on that tooth, going to um, having their performance, well performance into the mechanical aspects. Okay, so the dental crown, you can see the dental branches that are nothing but the um, having the interdental papillae that are nothing but your um, wisdom. Okay, and then you can see the dentine. Okay, dentine, that is the below the enamel, you can see. Okay, as you can see the various parts that are going, we are going to see one by one. Okay, so we are going to see root canal, we are going to see neck of the tooth. Okay, we are going to see lamina propria of the gums. Okay, and we are going to see the pars fixa of gums that are going to get support by this um, these gums are going to uh, get support or going to provide a space for these tooth going to anchor into it. Okay, that you can see the dental veins into the dental canal. Okay, that dental root you can see. Okay, the apical formation of the tooth. Okay, you can see the cementum, that will be the main structure to having with the embedded into the your gums. Okay, so you can see the dental arteries, pulp chambers. Okay, and the various predominantal ligaments. Okay, so as you can see, the first part, very first part will be the crown. Okay, as you highlighted in this green color, that will be the part of that crown. Okay, and the articulating surface on the most superficial part of the crown, there will be the articulating surface on the crown. Okay, and that are designed to accommodate the function of the tooth. Okay, the crown of the tooth is visible part of the tooth in the mouth. Okay, and while the root is hidden beneath the gingiva, that is nothing but your um, uh, that muscular sections that are going to provide a bed for this anchoring. Okay, and that gingiva and the alveolar bones. Okay, the hidden part, that is nothing, are called as the tooth root. Okay, so it has pearl white to the yellow color. Okay, the color of that crown. Okay, and depending on the thickness of the enamel, the age of the patent or the patient uh, are going to their oral hygiene and the lifestyle choices. Okay, the enamel is the outer layer of the tooth, and it is extremely hard and the durable. That means is going to having the big lifespan. Okay, so the next part will be the that underneath, that is tough and the anterior lines, as a second soft layer that is slightly darker in color and is also known as the dentine. Okay, as you can see, the highlighted in the green color will be the dentine part. Okay, and it is slightly darker in color than the crown. Okay, as you can see in the right hand side picture, that above that shaded green shaded part, and you can see the clear cut difference into the that shining part will be the crown. Okay, the whitish one, and the cream color part will be having the outline, that is nothing but the dentine part, which is highlighted in the left side picture into the green color. Okay, so this is the capsule that separate the hard outer tissue from the soft and fragile pulp cavity. As you can see in the pulp cavity, which is highlighted in the above picture in the green color. Okay, so which is the most inner layer of the tooth and contain the blood vessels and the nerve of the tooth. Okay, so as you can see in the picture that having the some pulp cavities. Okay, as you can see the some advertised commercial advertisement which having the some toothpaste having the some shells in the hand. Okay, and they are protecting that calcium shells by means of giving the brushing to these shells. Okay, and that having in that cavity that nothing but the bacterial infections are going to come there and going to reside forever into that pulp cavity. Okay, and that pulp cavities infections are not irreversible. Okay, once they are going to touch your pulp cavity, then they are not going to shed off from there. Okay, then you have to go to the dentist and you have to take a treatment for your root canal. Okay, and then the crown on that particular dentine part. Okay, that on that dentine part the cap, that metal cap is fitted. Okay, so hence that root canal treatments are given to the personals who having the problem with the pulp cavity as well as the root canal that having with the infections on their veins or the arteries of the tooth. Okay, so the soft fragile pulp cavity, which is the most inner layer and of tooth, contains the blood vessels and the nerves of the tooths. Okay, so as you can see the enamel and the dentine must be intact in order for the tooth to stay alive and healthy. For the once any bacteria enters into the pulp chamber, then the damage is irreversible, as I said. Okay, so the second part will be the root. Okay, we have studied this total anatomy into the two parts only, that will be the crown and the tooth root. Okay, so the second part will be the root. What are the highlighted points into the root? Okay, so the root of the teeth, whether they are single or the multiple. Okay, there are some tooths like the canines and incisors which are having the single root, and after the premolar, molar and first molar, second molar and the third molar having the variations into the roots. Okay, so this is the picture of the first molar which having the four roots of that particular tooth. Okay, hence this transverse section has taken, you are going to visible only two root anchors. Okay, so that highlighted invisible part into the mouth cavity which is known as the root. Okay, the root of the teeth, whether they are single or the multiple, as I said, in number, each have to the three previously mentioned layers in their makeup. Okay, so the pulp chamber that continues down from the crown into the root. Okay, and finish at the apex of the root where there is an opening which allows the structures of the pulp chamber to the exit and the entry. Okay, so this is also surrounded by the dentine. Okay, and that finishes just before the apex where it's surrounded not by enamel but by the cementum. Okay, we will see what is the cementum is. Okay, as you can see the cementum is the histologically different from the enamel. Okay, that cementum as highlighted green border on the roots. Okay, and that cementum is the histologically different from the enamel. Okay, the enamel is the hard, which is hardest covering, the fragile, not fragile one, and having the long lifespan. But the cementum is histologically different from the enamel, but it acts as its equivalent like the enamel. Okay, and just below the gingival line and covers the entire root of the tooth. Okay, it covers the entire root of the tooth, hence for the protection. And the tooth is made up of the crown and either single or the multiple roots. Okay, so anterior teeth that in both the upper and the lower jaws from the right first premolar to the left first premolar. Okay, right first premolar to the left first premolar are the single rooted teeth. Okay, and one, the upper jaw, the maxillary second premolar or made having the two roots. Okay, and all the maxillary molars that having the upper side molars. Okay, maxillary means the maxillary molars have 2 to 3 roots, and lower jaw, that will be the mandibular premolar, has a single root and the molars have 1 to the 2 roots. Okay, so this will be the variation into the roots. Okay, the arteries and the veins, as you can see, the highlighted thing that having the root canal as well as the pulp cavity, which are having the network of the arteries and the veins. That arteries are highlighted in the red color as well as veins are highlighted in the green and blue color. Okay, so the blood supply that uh, for the tooth which is needed, which originate from the maxillary artery. Okay, and which is the largest terminal branch of the external carotid arteries. Okay, so it is responsible for supplying the deep structures of the face. Okay, and the specific arteries that carrying the blood to the teeth levels. Okay, and through the root canal that have the following names. Okay, from the root canal that having the names like the anterior superior alveolar artery. Okay, the posterior superior alveolar arteries and the inferior alveolar arteries. Okay, so the vein of the teeth follow the arteries that having the similar names, they drain into the pre pteroglotid plexus, that are the facial veins. Okay, so as you can see that highlighted arrows showing the arteries and veins network. Okay, which are occupied by the pulp cavity as well as the root canal and having their way into the your gingiva. Okay, so the nerves which are present into the tooth, that are the nerves supplying the teeth, which also accompany the arteries through the root canals and the originate from the maxillary and the mandibular branches of the uh, trigeminal, that trigeminal with the fifth, that will be the mentioned as the canal nerve. Okay, and near the teeth, that these major nerves gives rise to the following branches, that are nothing but the superior alveolar nerves and the inferior alveolar nerves. Okay, so we have seen the main parts of the tooth. Okay, we have seen its anatomy and the histology. Okay, so the that having the pulp cavities, having the root canals, having the pulp chambers, dentine, cementum, and having and having the two ways roots. Okay, three roots, the variation into the roots. Okay, so we have seen its arteries and vein networks in which is situated into the pulp cavity as well as the going through the root canal. Okay, so we have seen its maxillary nerves that are the superior alveolar nerves or the inferior alveolar nerves. Okay, so the key fact about the tooth anatomy and the tooth about the tooth is, okay, so the types of the teeth, that are the two types, that deciduous dentation, that are the milk teeth, which are in 20 in the number up to the age of the sixth to the um, up to the adolescence. Okay, so and then will be the permanent dentation, that will be the 32 in number. Okay, and the teeth numbering notations which are given by the ISO FDI systems, that are the international standards, that universal numbering systems having for these tooth numberings. Okay, that are the known as the Palmar system, is situated in the uh, which is originate into the United Kingdom, that is England. Okay, so main part of the tooths are crown, pulp chamber, the neck, okay, and the dental root as well as the root canal. Okay, so neurovascular supplies for the tooth, that arteries like the anterior superior alveolar arteries, then the posterior superior alveolar arteries, then inferior alveolar arteries, and nerves which are supplies like the superior alveolar nerves, okay, and inferior alveolar nerves. Okay, so we are going to stop here and we will meet in the next session with the next organ. Okay, so bye till the next session. Thank you.